Sleep is we know that sleep's important, and it's important for health and wellness. And however, it plays an important part in general quality of life, and it's something that's all too frequently affected. And I think it's fair to say that there's not many people who we are likely to meet who haven't been affected by poor quality or quantity of sleep somewhere along the line. Some chronically, some for shorter periods of time. What I was going to say was that today is that we, as dentists, it's funny, as dentists, we hear the statement, "Oh well, I asked my patient what they about their sleep, and they couldn't understand why I was asking." You know something? People are not stupid, and if you ask, there's a fairly good chance that they will understand. And they'll either understand in one of two ways. One, we look at it from our way, our perspective, and see it. And I'm suggesting that maybe we'll look at the other way. Okay, so what I mean is, there are two reasons primarily that people are going to there are two things that people are going to pick up on. If you are, or someone in your team, ask them about the quality of their sleep, the quantity of their sleep, and wait for an answer, either they are going to think, well, that's because they can make oral appliances. I've heard of those, and you know, if you go to a dealership, you're not going to buy eggs. They know what and why, and if they can see some value in it for them, they'll pursue it. If they can't, they won't, no matter how much you think they ought to. But the other reason is that sleep does impact the quality of life. And if you're seen to be someone who understands that, then you're understanding something very intimately about that person. You're understanding, you're feeling for that person within their life. And we're all in a big hurry to improve our connection with our patients. One would like to think for other reasons too, but also from an acceptance of treatment standpoint. I don't think there's any better way of improving treatment acceptance than having the patient actually like and trust you. So I'm not for 1 minute suggesting that we ask our patients how well they slept, because that will help us to sell dentistry. That might be true indirectly, but that's not what I'm saying. It used to be a time, incidentally, when doctors used to ask, "How are you sleeping?" Strangely enough, they don't ask that now. I don't understand why. It used to be something that seemed to be important in the good old days, but maybe none of us. Maybe there's too many other things, too many distractions. Anyway, so the bottom line is here, the takeaway. Ask your patients. If you can't fulfill, or you don't want to fulfill needs that arise from asking those questions, deal with them either through someone else or someone else in the office. We were there yesterday, but the bottom line is, ask the questions, because that will improve your connection with that patient and their family, and that is not a bad thing. In the many years that I've been a dentist, I've seen the pendulum swing the wrong way. We've gone from a profession which was actually ahead of physicians in trust. I don't know where we are now, but I have a suspicion we're somewhere else, and I've got to be careful what I say here. I just don't want to make any comparisons. You may already have known what I was going to say, but the bottom line is here that we're not where we should. We're not where we could be. No, we're not where we should be. And if we care a little bit more, we will be. And this is an ideal way to make that first connection. And those of you who are in practice for any length of time know full well that to be true. Anyway, thank you. Have a great day.